Hi, as Claire said, I am Dr. Hayley Reed, a research fellow at the Decipher Research Centre, talking today about logic modelling. I should say that these slides that I've prepared today are an adaptation of slides we utilise within Decipher. So this is drawn on not just my knowledge, but knowledge of quite a few people within the centre, and has been developed over time because we do deliver short courses, and part of the short courses is sessions on logic modelling. My research has a focus on mental health, and I'm going to try and draw on some examples of where I've used logic models myself, but I'll also draw on some more of the examples in the wider literature. So I just thought we'd start off very basic, thinking about, well, what is the logic model? What is the premise of it, and why do we do this? So we're thinking specifically here about logic models which are utilised for interventions. So for us to visually or diagrammatically represent an intervention. So this can be in terms of just the intervention itself, in terms of the system in which the intervention is going to be implemented, but also in terms of kind of those interactions between the system and the intervention. So generally, we have a focus on thinking about the inputs, the activities, the causal processes, which are sometimes called the mechanisms of change, or the outputs, depending on the different terminology people use. But this is basically when we put activities in place in terms of an intervention, how we make change or how we think the change happens, and how that then results in the outcomes. So I wanted to talk a little bit to start to just say that people get a little bit confused sometimes between logic models and theory of change, and conceptually they are distinct in terms of originally logic models were there to kind of describe how inputs led to outcomes in terms of interventions, whereas theory of change models really were more about why. Now, as I'll go through, there are different types of logic models, and the advances in logic models, and specifically in system-based logic models, means that there is a lot more conceptual overlap, and they're probably a lot more similar than they were before. Can I come up here? So the first type of logic model I'm going to talk about is process-based logic models. So these are logic models, and this is taken from a paper by Eva Rifas, where she talks about process-orientated logic models, which tell us basically how they capture the elements and process of the intervention. So going from one stage to the next, from the input to the outputs, to the activities, to the outputs and outcomes. They can be quite linear in terms of this, and some of the reasons why people use these type of process logic models, and I'll show you kind of the Kellogg Foundation has put together a kind of standardized format for these, is that they are quite easy to read. They don't have too much in them in terms of complexity, and really it is intended to show the theory or the internal workings of that intervention. So how we get from input to impact. And along this way, if you like, we are articulating and really outlining some of the assumptions we have for interventions. Now, we all would have read papers where we talk about interventions and we have descriptions of interventions within papers. However, and also, I suppose, there is the TIDIA framework, which is like the template for intervention, description and replication, which gives us an idea of what we should put in terms of a description of intervention. But actually, logic models also show us the processes from one to the next. So this is something which really helps in terms of those assumptions and outlining those assumptions, which can sometimes be not within the descriptions. So here is a one intervention, which actually is not an intervention that I was part of. This was part of a large cluster randomized control trial in secondary schools. So it was done in 25 secondary schools in England, southwest England, sorry, and in Wales. The point of this was that it was an effectiveness trial, but there was also an embedded process evaluation within this. So this was an intervention about well-being in secondary schools. And the idea and the main focus, as you'll see from the primary outcome, was actually teacher-based kind of well-being, but on the route to be able to support young people and their well-being. So reading this logic model, if we start from kind of the left-hand side, and there are conventions in logic models in terms of they usually read from left to right or top to bottom. The arrows show directionality in terms of causality, and we have different parts to them. So we start off on the one side thinking about, you know, training, and that's a really important input, which is underneath that intervention part. But the second set is more around kind of activities which will happen in this intervention. So it says there that 8% of staff were nominated to do mental health first aid training. Another activity, so a separate activity, was all of the teachers, not just the 8%, but all of the other teachers kind of attended 1 hour sessions to introduce the project as a way of kind of embedding it into the school. And then also the teachers who provided pastoral support did another day's training in terms of schools' mental health to increase their confidence in developing those skills. So it clearly outlined there kind of the input resources and activities. And then we move on to maybe, which is the bit which is usually missing from descriptions of interventions when we write them in quite a narrative way, which is those mechanisms. Okay, and it's sometimes the bit in interventions which is really missing. So we know what we're putting in and we know what we want to get out, but we're not always sure what happens in the middle. And intervention logic models are a way to kind of explicitly articulate this. So, for example, we said that, you know, the training of teachers, all teachers would have access to support and advice. And there was some thought when this logic model was developed that that would directly improve teacher well-being. So the arrow shows they go straight to the primary outcome. But actually, there's a second mechanism here in terms of improving staff and student relationships, which can then go on to support even the secondary outcomes. So this is just one example I wanted to give you in terms of kind of a more process-based logic model. And the thing about this, and one thing which people do say in terms of process logic models, is sometimes they can lack the understanding of complexity. And we'll move on to think about system-based models, which is another type, which really tries to hone in and focus on that complexity. Now, what do we mean by complexity? In terms of complexity and complexity science, we think about an intervention, and the process models clearly show us the intervention. However, there's also the idea that that intervention doesn't get placed into a system which is a vacuum. It gets placed into a living social system, such as a school, such as hospitals, and actually that intervention will interact with that system. So the context and what is already happening in the system can be really important. And sometimes as researchers, we want to model that in our logic models. We maybe think about how much complexity we put into those models, because it could be infinite in terms of all the things you could talk about in terms of a system. If we think of this in terms of maybe schools, we can think that obviously schools they already have a history in terms of the school, how the teachers work together, the ethos and support in the school. And then we're putting an intervention, and that intervention kind of interacts with it. So this kind of depicts the system in which the interactions between the participants, the intervention, and the context takes place. But as I said, you might want to think, if you're going to use a systems-based logic model, about prioritizing what you do put into those logic models, because there is an opportunity for them to become too complex and too overbearing for people. So going back to kind of the idea of a school-based intervention, because this is where I work, is mainly in kind of adolescent mental health in terms of schools. The system is part of a subsystem. There will be subsystems in the school. So there will be certain departments, there will be certain pastoral care and care in terms of a subsystem of well-being in the school, in terms of a subsystem of the senior management team. And those schools are also part of kind of macro systems. So they're not just, schools are not just able to do exactly as they want. They're part of local authorities who will give them support, but also will lay down processes they have to follow. So as you can see, you can already get to a point where there is a lot of complexity here, and the too much can be overwhelming. But quite often we think of the Wisconsin extension when we think of trying to map out system-based logic models. So if we look at this, we can see that as well as having the inputs, outputs, and outcomes on this logic model, we also have things such as the situation and priorities to start. So one of the things which can be first mapped out is, what is the problem? You know, what is this intervention trying to address? Why is this a problem? Who is this a problem for? So really trying to understand contextually the either epidemiological understanding of it, or understand what the problem is, who's the problem, and who has a stake in the problem, you know, who could be supporting this intervention, or who potentially could be working against this intervention. And that's another consideration in terms of who's working against. We know with a lot of smoking-based interventions, for example, there's big tobacco who are actively trying to stop those kind of interventions. So, you know, we could map out that. We then think about, okay, well, when we're doing the inputs and we're thinking about the mechanisms of change, what are the assumptions underlying? So this is around the beliefs. So what do we believe putting in those resources will change? How do we think this will change? So for example, as I said, I work in adolescent mental health. It could be that our inputs are clinical psychologists who are going to run activities to train school staff to deliver an intervention. But actually, the intervention we deliver could look very different, the materials we use, and actually the mechanisms we focus on. So it could be here that we outline something in terms of, say, a cognitive support, so cognitive restructuring, how we change young people's thinkings and beliefs. It could be something in terms of behaviour, particularly things like behavioural activation, and that's the change we're trying to make. We're trying to make young people behave in a different way, so they do more positive, or, you know, go towards more positive activities. Or it could be an emotional kind of behavioural change, emotional mechanism of change. So this could be around emotional regulation in terms of how we support young people to regulate their emotions. So, you know, that outputs bit can look very differently, and our assumptions about how that will work will be different dependent on which of those mechanisms we're trying to focus on. Then, of course, there's also, in terms of outcomes, what can affect the outcomes in terms of external factors, you know, the success of the intervention. So this could be in terms of, we may be putting an intervention in a school where there's quite strong support for mental health already, so actually there wouldn't be as much change. But there may be some places where there's quite a strong resistance against change, so external factors such as parents, such as people who don't want their children to be part of the intervention, etc. So as I said, we could map all of that out. So as well as there being kind of those two types of logic models, Mills and colleagues talked about kind of advancing the kind of complexity science part of the logic of logic models. So their interventions really looked at patient experience toolkits, particularly within hospitals. And the idea of these kind of logic models, and the paper kind of talks about 4 different types of logic models, and they almost do this in a way where they think about, you can have a process-based logic model, which is their type 1, which very much focuses on the intervention with nothing about context. Type 2, they term as system-based logic models, which they say actually it's about the intervention, but also it can map out the context. Then they have this other layer, which they believe in terms of, I suppose the right way to say it is the strengths of how they interact, so how the intervention interacts internally with the other components, or how it interacts with context. And those are type 3 and type 4. So this one is very much a type 2 intervention, and this is how they started out thinking about the patient experience toolkit within. And they've mapped context here. If you have a look actually at the moderator section, they've mapped kind of the outer factors and the inner factors. So they've thought a little bit about the system in terms of the organisational support for the intervention, the fit with the policy context, the staff and service pressures. So are they able to deliver this intervention in terms of that? But also inner factors, so access to things like multidisciplinary team structures, supportive culture, staff resilience and well-being. And also we can think about how this fits with how people think we should do kind of work in this area. So yeah, their idea was like this was a type 2, but they did focus a little bit more on trying to at the end of the paper. And I said, this is a really good paper if you're really interested in how we map out the relationships between different contextual factors and different parts of the intervention with context. They kind of drew on this, which is a type 4 example of the model. And what they say is they think this successfully captures how the intervention or the success of the intervention hinges on adaptation of context. So what this means really is that an intervention may be able to look slightly different in different contexts. So in different hospitals, they may deliver things slightly different. And we can try and capture some of that complexity. Now, we can do that by thinking about maybe function and form within interventions. So, for example, if I wanted to upskill people within hospitals to understand the patient experience toolkit, one of the things I could do is I could do face-to-face delivery. So that would be the form. Another form would be that I could give them leaflets. Another form could be that I give online training and they do an online module on their own. But the function of those things are exactly the same. And they say that you can try to kind of account for different interventions, account for how interventions can look different in different settings. So the next question we had was actually how, but I've changed it around and I've done why first because I thought it made more sense when I put the slides together. So why? Why do we want to construct logic models? What's the purpose in there? And I did talk earlier about, we've all read papers where we have a description of an intervention, but we don't necessarily understand it. So one of the things is to explicitly articulate the often implicit assumptions. So I talked a little bit just now about how different cognitive restructuring, behavioral activation, emotional regulation, how there's different implicit assumptions about how they change young people, which could change mental health outcomes. Now, in some cases, we as a team, as a research team, or as service providers, we all know in our own heads what we think those assumptions are, but this is just about explicitly getting it down kind of on paper. We do find sometimes that actually there are different understandings of an intervention. So again, this is another reason why we should kind of do this, because what one person thinks about how this intervention gets to outcomes may be different to what another person thinks. Now, it's not saying that anybody's right or wrong, but it may just be that that shows us some of the key uncertainties, and we can test when we evaluate interventions. So one of the obviously areas which are really important in terms of evaluating is thinking about effectiveness evaluations, but also process evaluations. So one of the things we can do in a process evaluation, which will run alongside the effectiveness evaluation, so we can interview people, we can do observations, but we can focus that on what we think we're uncertain about because of the logic model. So the logic model can actually be, particularly in development, the early development stage, can be something which lets us know what we don't quite understand and what we need to get more evidence and more understanding on for this intervention to kind of work. And a project I worked on recently, for example, was an intervention with veteran families, thinking about restorative approaches within families to heal the harms in families where maybe a veteran, because of post-traumatic stress disorder, has done things which has been not great for the family. And one of the things we found actually was, whilst people wanted the other members of the family, the logic of what the third sector organisation was doing was they wanted people within the family to have empathy for the veteran. Now, what we found was actually without the psychoeducational component, which wasn't mandatory, so teaching people about mental health, teaching them about post-traumatic stress disorder, they found and struggled really with empathizing, because sometimes family felt, well, this is just the veteran. They couldn't see that actually their actions were due to the mental health disorder, the post-traumatic stress disorder. So again, that kind of key uncertainty, when we tested it, kind of came out, and we were able to modify what we were doing in terms of the logic model. Again, and kind of a little bit repeating in terms of exposing weak links or things which don't work, to map out and support our resource planning. So one of the things we need to do is ensure we don't develop up interventions which seem like a great idea, but they're not feasible. So this can help us to think about what resources we need before we think about, delivering an intervention. And the last one, obviously, is to identify when context and implementation may compromise the programme. And just again, thinking about that kind of explicitly articulating the assumptions, that's really important for replication and adaptation purposes. So if we know an intervention is effective in one country and we want to bring it to another country, we really need to understand how that intervention works and what's the theory underpinning it so we can replicate it. So again, how do we generate or refine logic models? There's no standardized way to do this. And I've already talked through the kind of two different types of logic models we have. But there's also in Eva Reed's paper, they talk about there's potentially 3 different approaches to how we refine or develop logic models. So the first they say is an a priori logic model. So that is where at the very outset of the intervention, before you've even delivered it, you do a lot of work and you try and get the most robust and accurate logic model possible. So you put a lot of resource in at the beginning, and part of that is because you want to make sure that you understand how this intervention is really going to work. So it's agreed at the outset, this is how this logic model works. One of the things is that can be quite resource intensive early on. But the other thing is that cannot reflect the emergent things when you actually put an intervention into a system. So we've talked a little bit about that context. So some people think that actually a priori, you can't have an intervention where you go through, say, evaluation phases or feasibility phases where you don't do any modification as part of this. The second way people have talked about this is in terms of stage logic models. So this is where you, before you start doing any work in terms of evaluating and supporting the intervention in systems, you think about, okay, well, at what points will we make changes to the logic model? So there can be several points. They're usually major data points or major points where you've collected data. So it could be after the first time you've piloted the intervention, and then that's a point we are going to then make changes. And I'll show you an example of how this has been done in practice in a couple of slides. The next way is kind of a more iterative model. So this is where you constantly refine the logic model throughout the development, evaluation, the feasibility testing. You're constantly making changes, which can work and can then be based on different people's views as you go along. However, one of the things which is a bit difficult, and I've got another example of an iterative logic model we've developed, is that you have to be very good at documenting this. So if you don't have specific points where you've collected data, let's say, or you've worked with stakeholders, you have to be very good at saying, okay, I'm going to modify this part of the logic model and documenting why you did that. So you've got accountability at the end, okay? So I've already moved on a little bit to talk maybe about the Medical Research Council guidance in terms of the different stages of development and evaluation of complex interventions. Now, in this guidance, this is the 3rd or 4th iteration of this guidance, so it has been developed and refined over time. We kind of have maybe, let's say, 4 different phases in terms of developing interventions or adapting them, or identifying interventions which are already in place. Feasibility testing, so the first time we pilot an intervention, where we put it into a system, we record and understand what's happened in terms of whether we think it worked, whether there was some pushback about it, whether we need to change the intervention at all. And then evaluation and implementation. So I think I just wanted to highlight this because I'm going to be talking about these different stages as I go along in the examples that I'll use of how I've used or how we've drawn on logic models in Decipher previously. But I think it's really important to think if you're going to do a staged-based intervention approach to logic modelling, that you map out where on this framework you are going to make those changes, obviously in an iterative way. you would think about doing it throughout, and there wouldn't be those specific stages. But I think in all of the guidance which has been out there, it's always talked about developing the logic models at the very earliest stage. So when you're developing an intervention, that's when we should be having our first iteration of logic model for a program. So what do we draw on in terms of evidence or to develop logic models? Well, I think there's three different areas. So first, we can identify existing theory. So, you know, social science or psychological or organizational theories, which are already out there. People have already developed them up, things like theory of planned behavior, for example, and how we can bring that and draw that into our logic model, because it makes sense for the problem we have. And when we put the resources in, how that mechanism of change will work. The other area which is really important is involving stakeholders. And by stakeholders, I mean members of the public, so your target population. I also mean those who are potential delivery people, those who are the people who will be funding or supporting the intervention or in the wider education, health or social care kind of systems. So involving them at different stages on what they think the logic model, how they think the intervention will work and what they think the logic model should look like. The third is the location of emergent evidence. So this could be, again, around that kind of problem setting thing we talked about earlier. So when we're thinking about the problem, do we have epidemiological evidence on the population and understanding what the public health of the needs in terms of the public health topic or the health topic? And also the developing or emerging evidence. So again, this can be the evidence you are developing along that kind of MRC framework in terms of once you've feasibility tested, what have you found out and how you can modify the intervention on the logic model to show that. So I'm just going to give a couple of examples in the kind of last 10 minutes of where we've used logic modelling. My first example is for a study which I was only a small part of. I was, before I became a researcher in Decipher, I was the Involving Young People Research Officer, and I run an advisory group of young people called Alpha. And we were invited to be part of a project which is about sexual health and positive relationships in further education. It's called SAFE. And as part of this intervention, the team got a Medical Research Council FIND fund, so that's Public Health Intervention Development Fund. They got a small bit of money to do some intervention development work around sexual health and positive relationships in further education. And one of the things they did was they reviewed the literature in terms of what was already known to potentially be important. And they had 4 different areas they focused on in that. So it was student-led sexual health action groups. The second was sex and relationship education. The third was on-site access to sexual health and relationship services. And the fourth was staff training in safeguarding about sexual health and relationships. And as part of this process to develop the intervention and develop the logic model, they ran workshops or consultations with the Alpha Young People's Advisory Group, which I was part of. They run consultations with sexual health charity workers, so Brook charity workers, and also people within Brook had a Young People's Advisory Group, so they input into the development process. And they had input from a wider stakeholder advisory group in terms of academics and policy and policymakers and practitioners. So when we were thinking about how we would involve young people in developing logic models, we actually thought about using this as a way to kind of upskill young people. And I just think it's a really quite easy way for you if you wanted to work with people on developing a logic model, which can maybe be something that people, particularly members of the public, haven't come across before, haven't done. We did an activity with them where we asked them about, and we taught them about baking a cake and thinking about the inputs, the processes, the outcomes. And here I think maybe you think about maybe the shorter term outcomes and more what we can think of outputs, and then kind of the longer term outputs. So we did this with the young people to show them what we meant by a logic model. We then asked them with different colour post-its, and I'm sorry that the photos of this aren't very good in terms of they're quite dark, so my apologies. But you can see we gave them different colour post-its and we asked them to talk about the inputs, the activities, which we'd already mapped in terms of the literature and what they thought of those, what they thought potentially the sexual health outcomes should be, and what they thought the relationship-based outcomes to be. This was about relationships as well. So we worked with 8 young people, 5 females, 3 males, doing this in terms of the intervention. And as I said, this was done with a lot of other stakeholders as well, this kind of mapping exercise. And it supported kind of the refinement of the initial ideas. So whilst there wasn't a logic model at the beginning, this ended to be the logic model at the end of that process. And one thing maybe to highlight is actually due to the work we did, it ended up being 3 out of the 4 activities were core intervention activities at the end of that development phase. So there was actually, the team removed the sexual health action groups for young people because young people and service providers just didn't think they were really acceptable. They didn't think they would work very well with young people. So this ended up being the logic model in terms of that. So my second case study, if you like, in terms of logic models, is actually a piece of work that I'm still conducting now. So it's about intervention adaptation. So I have got Health and Care Research Wales Fellowship, and we went through a selection process, and I won't talk too much about that, but we did kind of a scope and review and then looked at effectiveness of interventions to screen on the numbers of interventions we found. And then we went on to work with stakeholders to decide which intervention would be the best one. But I'm not talking about that selection process today. What I'm talking about is once we selected that intervention, which was called the Pride intervention. So this was in India. It was a brief problem-solving intervention. And I should say the intervention population we wanted to focus on was those with subthreshold anxiety and depression symptoms, mainly because we know those young people are more likely to go on and have disorders, have anxiety and depression in the future. So this is a preventative intervention for targeted groups of young people. So the Pride intervention itself had a formative piece of work in India where they spoke to young people and they spoke to school staff, and they said the stress and tension were really big problems for those who they thought were kind of subclinical anxiety and depression candidates. One of the things they did from that is they drew on theory. So they said, okay, we're going to look at the stress and coping theory to be able to help us. And the main mechanism will be around problem solving. So if you like, the changes in the skills, the coping skills and the problem solving skills of young people to either solve the problem and or change their thinking about the problem. So that it's the importance of it means that actually it's not a problem which causes them issues any longer. And there was a randomized control trial of this, so it's evidence-based and it's face-to-face lay counselling, which was compared against problem-solving booklets. So we had this intervention, and the whole point is talking about it here is the fact that whilst we allocated this intervention, there was no logic model. The original intervention team had not produced a logic model about it, and we were at a point where we thought, actually, we do need a logic model. And we did develop up a tidier framework, so a description of the intervention, but alongside that, we did the logic model. So how did we do that? Well, we were very lucky about the fact that there was already quite a few papers published on this. So there was effectiveness papers, there was process evaluation papers, and there were also intervention manuals, which were quite detailed. So three researchers, we independently used the tidier framework to synthesize what was already in published papers and the manuals. And then we met in a kind of finalization meeting where we all talked about what we thought were the inputs, what we thought were the activities, the mechanisms and the outcomes. And we mapped these, if you like, in that meeting to have an initial kind of theory of the intervention. And this is very much, if you like, a iterative change, because we didn't have specific places where we were going to change this logic model. We simply had, we will do these different bits, and when things come up, we will change it if we think there's enough evidence to change it. We then had meetings, and the output, so the logic model was reviewed by the research team, which is the original research team in India and at King's, because King's College in London were part of the evaluation, and the delivery organisation. So there was an organisation, a third sector organisation called Sangha, who were the people who supported the delivery of the intervention in schools. We then, after they had worked on the logic model and refining it, we actually just sent them the logic models to refine. We did the same with our young people. So we have 2 public contributors who are team members. They sit in our monthly team meeting, and they looked at the logic models with us as a research team and our study advisory group of policymakers and practitioners. Now, the one thing I would say about this logic model is it's very detailed. So I will show it to you. But the detail in here comes because we want to adapt it. So the team had conscious discussions around, do we need all of this information? And actually we thought we do need it to be quite detailed, because if we are going to adapt it, we do need to think about what we will be adapting and how. So the content, if you look at the context bit, which is at the very bottom, one of the things which it kind of outlines is the context. So it is more of a type 2 intervention logic model. But some of these things we didn't link. So it's not a type 4 because we didn't say how that context affects different areas, although we do know this. So in the intervention, clinical psychologists recruited, selected and trained, lay counsellors. Those lay counsellors went into schools and did sensitization, classroom-based meetings with young people to increase their understanding of mental health and the intervention. And then those young people who put themselves forward were referred and screened before they got the face-to-face intervention. Now, we know that contextually there is a lot of stigma, and there's maybe less understanding of mental health than in other areas of the world than in India. So they found that the sensitization part was really important and kind of mapped that out. And this is something we're considering whether we need here, but we didn't show that interaction, if that makes sense, on this logic model, because we thought it was complex enough as it is. Right, so my last example is not actually an example that I was part of, but somebody else within the research team, Professor Graham Moore, within Decipher, has been part of this evaluation. So this was kind of more about intervention evaluation. So the intervention was in Freiham, which was a new residential development area in Munich. And there's a lot in terms of what is written and a lot done in terms of municipal interventions. So what they mean by that is town-based interventions. So when you have a new development, or when you have a town which maybe there are some issues and problems, they will do interventions on that kind of town level. So that's almost the system, the setting. This new residential development was going to have large social housing, and we know that those with low socioeconomic status have worse health and education outcomes. And this is some of their theory and some of the reason why they've done this intervention. They wanted to put in a kind of network of support for families. So this is the intervention kind of focuses around this network. They have network coordinators who bring together different service providers from social care, education, health for families. And another part of their logic model was particularly about kind of, especially during transitions. Okay, so not just a transition into the housing area, but transitions for the children when they go from, say, let's say a primary to a secondary school. They know that's important, so they focused attention on supporting schools at that point. So they've used a stage approach to logic modelling, and this is a really good paper. It's only just been published in 2025. It's a really good paper of thinking about how they developed up a stage model. So they defined prior to doing this that they would have a first draft logic model, which they developed up, if you like, by producing, by looking at other examples of these municipal interventions. They then did a process evaluation where they interviewed people, including the network coordinators, other service providers in the network, other people in the municipal, and then they changed the logic model. They did a workshop with wider stakeholders. And then again, at the end, they did something where they looked at how they could map and support outcomes. So this part of it was very much about not only they did a scope and review of what could be outcomes for this intervention, and then they worked with the municipal to make sure that they would be able to collect those outcomes. So again, they changed the logic model based on that. And just to say, this is the first iteration of the logic model. Obviously, there were 4 iterations because I've said it's been changed throughout. And if you like, one of the things they've done really well in this paper is then say that this is kind of stage 4. So this is a type 2 intervention, sorry, a type 2 logic model. So they've said, okay, well, and very clearly outlined how in the first stage, after they did the process evaluation, what they found was there was a lot in terms of barriers and facilitators for implementation. Some of those barriers were around kind of budgets. Others was around there wasn't enough engagement from some services in that kind of network. So social services, for example. So that was something they strengthened in the intervention, but also in the logic model. So we've got a part which is more about implementation. The second step then, when they did further work with people in terms of the workshops they run, they found that actually, and you'll have noticed maybe in the first one that they had health and social outcomes, but they've added to this educational outcomes because it was thought that the educational outcomes were really important and they were something with that they should be following up and the municipal should be thinking about, particularly in terms of targeting that transition, that they thought that it would be important. And then after that stage, they did further work in terms of thinking about the indicators, as I said, in terms of scoping out what indicators they could kind of focus on. And from that, they've actually expanded on the intermediate outcomes. So they've added 3 sections, whereas previously they had the 1 section. So they said they were intermediate outcomes for the structures, so changing in support infrastructure, for the professionals themselves, and for the target groups. So they kind of drew that out a little bit more in the logic model. But I think it's a really good paper just in terms of thinking about, they have a reflective bit at the end, which very much talks about what was supportive in terms of what are the advantages of doing this stage model. So they said, you know, it facilitates and focuses you on reflection at key points, which is really good. It supports planning for the research team. There was an integration of a variety of different perspectives, which they felt increased validity. And also they felt like towards the end, the logic model was, you could utilize it more. It was kind of increased utility. However, they did say the need for documentation between those stages meant that that was very resource intensive. This is something which is, if you're going to change the logic model and change the intervention like this along the way, you have to think about the resources you need to do that. And that maybe even there's a need for some flexibility sometimes on deviating from your pre-specified milestones. So that's my last case study. So just in summary, logic models are used as a kind of visual representation, particularly to support us to clarify the assumptions that we have and how we think interventions work, how they get from their resources and they lead to outcomes, the level you involve in them in terms of complexity and how you think about the context and how the intervention interacts with the context is something which is a question for you as a research team. And other key decisions include what type of approach to logic modelling you'll take, what evidence and theory can you or should you draw on in the logic model, who should be involved in developing, revising and confirming your logic model, and when should a logic model be developed and revised? Is it something you're going to do iteratively, or is it something that you're going to do in certain stages? And as you can see, there was no standardized way of producing or presenting the logic models. So these are all decisions for you. My last slide is just a little bit of a plug in terms of, obviously I said this is stuff which we've adapted from our short course in methodological innovation in public health intervention science. These courses will be running again in June and in September, and I've put the link there. I know that the faculty actually allows people to apply for, there's a few free spaces for faculty members on these short courses. But if you want to know more about that, you'd have to talk to people in the faculty. I just wanted to raise that for people.